Thank you. Our group focused on the constructs of accountability and leadership, although I will warn you that most of our discussion focused a lot on the issue of accountability. I'm going to mention just a couple big themes that came up during the case discussions that we had. We had a very fascinating case about complications that occurred in the context of an operating room procedure, and the issue was, could there be team-based accountability? And that led us into some very interesting discussion about the context of when a particular incident happens and how that might drive whether the team could be held accountable versus an individual. We did note that while current structures such as insurance systems and the courts are unlikely to be capable at this point in time to look at issues of team-based responsibility, we thought that there were some models in place at the systems level through things like root cause analysis that could look more at the team functioning and analyze how the team had contributed to a particular situation. And also to the point of accountability, we thought it was very, very important to have upfront structures in place that are transparent, that the procedures are clear, so that people really understand what it is that are the expectations. So that's a very brief summary of, almost an hour of discussion. Then we moved on to talk about the 3 different questions that you hear from each of the groups. And the first question was asking about, can diverse healthcare professionals be held accountable for their collective actions by patients and society? And I was told to be brief, so my answer is yes, but we're not quite there. No, actually we did. I'm going to talk a little bit about some of the things that we mentioned, but we had a very rich and robust discussion, and for the sake of time, I can't go into all the points that we made, but some of the things we talked about is that we weren't sure that as a culture, society was really on board enough with the issue of team-based care to operationalize this into happening, and that was a step that we talked a lot about needing to happen. As I mentioned earlier, issues of reimbursement come into play there with respect to the individual versus the team being held accountable. There are many changes that need to come into play here if we're going to do this, moving away from a culture of individual blame, communication, helping individuals understand how the complexities of the healthcare system work. We had a very robust discussion here. Our second question was whether healthcare professionals could hold each other accountable for decisions made collaboratively. And again, the sense was that we should be doing this, but there are things that we need to be talking about to get us to that place where that is a reality. We need to be having some culture shifts away from pointing fingers. We need to consider issues of power dynamics and the reality that they're out there, and we need to deal with those. There's different values from different professions that need to be articulated as part of this conversation. We need to operationalize efficient and effective healthcare teams. And again, this issue of transparency came up a lot for our group across the different discussions that we had. That was something that was very important, I think, to set up and establish ahead of time. Final question. You see, we talked a lot. We talked about attributes or structures that need to be in place to support this type of change. And again, we came up with many different ideas. Transparency, you see at the top of the list, not a surprise. Data from patients about whether this is important and how it might be important. We needed more of a behaviorally oriented approach to defining these terms. Target interventions at the systems level, address issues like the hidden curriculum. We talked a lot about involving the community, involving patients, looking at how we could measure these behaviors, what's out there already, what could be incorporated into those types of measures. Okay. And we also talked about some factors that will make this much more of a challenge, is that reimbursement systems, subspecialization, where we're focusing on individual components of healthcare needs and not the whole individual. There will certainly be barriers to trying to move in this direction. And I think we've covered, and we talked a lot about community, so that's my brief report. Thank you.
And for group number 2, we have Susan Shimonis.